Our next guest wants to get a message to the men watching today. Don't pass up on a potentially life-saving screening. Dr. Jeffrey Mullins is a urologist with CHI Memorial Chattanooga Urology Associates. We're talking about the PSA test, which most men and women have heard of, but there's some confusion surrounding it.
Yes, well, thanks for having me. And PSA is a confusing test for patients, doctors, and even urologists sometimes alike. What we know about PSA is it's really decreased the chance of a man dying from prostate cancer in this country. But on the other hand, it's also led to a dramatic overtreatment of prostate cancer. So some healthcare organizations have actually recommended against PSA screening in men, which I obviously don't agree with.
But so what it comes down to is you have to have a conversation, I guess, with your doctor to discuss this, because as a man ages, this is going to be a topic of conversation, right?
Yeah, absolutely. So the important keys are using PSA in a smart fashion. So identifying people who may be at high risk for having prostate cancer, including those who've had a family history of prostate cancer, especially a dad or a brother at an early age. African American men are at higher risk for both having prostate cancer and having higher risk prostate cancer. So identifying those folks up front, starting screening early. Then also, in just a general guide, using PSA wisely with other tests such as MRI, other biomarkers can really help us risk stratify a man for having prostate cancer.
So who, in your opinion, not to put you on the spot, but is there a certain age at which men should begin to get tested?
Right. For a long, long time, the recommendation was for 50 to 70. In reality, the average man now is recommended to undergo screening every year or two, starting at age 55 up to age 70.
So you've raised it by about 5 years now.
Right. That being said, age is just a number. There's a lot of really healthy 70-year-olds out there who would benefit from screening. And actually in this country, what we know is the men who are most likely to die from prostate cancer are actually over 70. So in my practice, I don't exclude those men from PSA screening.
Okay, so you get the PSA screening and it comes back and the numbers show, hey, there's something to watch for here.
Right.
Then is there just one standard treatment, or does it become a conversation with your doctor?
It's very much a conversation. So in the past, an elevated PSA always led to a biopsy, and biopsies have risk with them as well. But now we have better things to try to help avoid unnecessary biopsies. That would include use of MRI, which can help localize and visualize prostate cancer. There's other blood tests and urine tests that can help tell if a man's at high risk for having prostate cancer. And using all those things together, we can best identify the men who would most benefit from a prostate biopsy.
Okay, let's talk to the men and the women out there. How many men are reluctant to come in and get this test done, and how often do you see them that their wives have pushed them there?
Yeah, that's usually what happens, because men aren't very excited about having their prostate checked in general, and the idea of a biopsy or even prostate surgery is not appealing to most guys.
Are there signs to watch for before I let you go to let you know that perhaps you ought to get that screening if you don't fit the age criterion?
No, that's why PSA screening is so important. Is prostate cancer is asymptomatic. So we have to screen to detect it, because if a man develops symptoms from prostate cancer, oftentimes it's too late to have a cure. So that's why I think wise use of PSA screening and then wise use of treatment is very important.
And a wise relationship with your doctor.
Absolutely.
You'll find that at Urology Associates, CHI Memorial Hospital, the place to find Dr. Jeffrey Mullins on Glenwood Drive, 697-0072, the phone number. We're back with more right after this.